Greetings, New Vision members and friends. Just want to talk to you in a few minutes about some of the latest guidelines, testing, and where we are as it relates to COVID-19. We are currently living in most difficult and trying times as we attempt to combat this novel coronavirus. It is playing havoc on all of our lives, requiring us to be distant from our friends, our neighbors, our families. I'm sure that all of us have family members or friends that have been terribly affected by this disease. With God's help and guidance, we will fight this, we will defeat this, and we will all be better for having gone through the struggle. I want to talk in three segments. One, the newer signs and symptoms that we need to be aware of, the state of testing, particularly in the state of Ohio, guidance as to what we need to be doing to protect ourselves, and lastly, the reopening of our church facility for assembly. There are newer signs and symptoms that we need to be aware of. In addition to the initial symptoms of fever, shortness of breath, cough, other signs and symptoms have been added to this list. These are chills with or without shaking, muscle pain, malaise, headache, sore throat, the loss of taste, the loss of smell, and also skin changes, particularly around the lower extremities, the toes, discoloration, and also skin manifestation in the form of hives and other types of lesions. Should any of these symptoms occur with yourself or your family member, then you should certainly consult your primary care physician for further guidance. As of now, there is no universal testing in the state of Ohio. Testing and tracing of those deemed to be positive is the key to where we're going to be in going forward. Patients can present both symptomatically with the symptoms as delineated earlier, or they may be asymptomatic carriers, thus the need for universal testing. Currently in the state of Ohio, testing is categorized into 4 priorities. The number 1 priority is individuals with symptoms who are hospitalized or who are healthcare workers. Priority 2 are individuals with symptoms who are in long-term care facilities or congregate living facilities, first responders, critical infrastructure workers, 65 years and older, and living with underlying conditions. Category 2A are individuals and staff without symptoms who are in long-term care facilities, congregate living facilities where there has been an outbreak. And the last category are other individuals with symptoms, individuals with mild symptoms in areas with high coronavirus hospitalizations. In order to get testing, if you fit into one of these categories, you have to have a doctor's order. So what do we do then once testing has been done and we are either isolated through self-quarantining or we are in the general populace because we have tested negatively and are not carriers of the disease? It is important to adhere to the guidelines as currently stated. We should not congregate any more than 10 persons at a time, maintaining the safe distancing of 6 or greater feet apart from each other. These social distancing guidelines will probably remain in effect throughout the summer. If one has to be out in the populace, then masking and gloves are necessary. We should refrain from touching, even with gloves, of other individuals. We should also continue hand washing at least several times a day and hand sanitation. I recently sent out a flyer or a memo concerning the proper handling of groceries that we buy, the handling of mail and packaging that's delivered to our doors. I invite you again to go to the website www.JEFF.com. This is a very informative discussion about how we should be handling the materials that are brought to our door, the groceries that we have bought in our homes to maintain our resistance to this virus as much as possible. As we go forward, the annual conference, particularly Bishop Palmer, has now issued guidelines for the possible reopening of church services in a congregate manner on May the 24th. This, however, is a recommendation and is not put in stone at this time. This will allow us as a church to develop protocols for distancing, sanitation, ingress and egress to allow maximum safety for all of us parishioners. You will be given those guidelines once they are established and once we have been approved to continue in corporate worship. I invite each and every one of us to pray for a successful conclusion of this pandemic which we are currently involved. Love your neighbors, communicate with your neighbors, with your parishioners. They would enjoy hearing from you even though it's not a touching kind of situation. And most of all, be safe in all that you do. We will get through this all intact. I wish you well and continued blessings.